Bedpans are used for urinary and bowel elimination when a person cannot get out of bed. A standard bedpan is being used in this demonstration. The wider end is aligned with the patient's buttocks. Positioning may be easier if you ask the patient to raise her buttocks by flexing her knees and pushing down against the mattress with her feet. Slide your hand under her lower back and help her raise her buttocks. Hold the bedpan flat as you slide it under her buttocks, taking care to keep the gown out of the way.
Okay, I'm going to lift your head back up so it feels just a little bit comfortable, more comfortable. Okay.
Raise the head of the bed when the person is positioned securely.
Okay, now let me check and make sure everything's okay. All right, everything looks fine. Okay? All right.
Place toilet tissue in the call light within her reach and ask her to signal when she is finished or if she needs help. Remind her to place the toilet tissue in the bedpan.
All right.
Remove your gloves and wash your hands. Then leave the room and close the door until she signals for you. Knock before you re-enter the room.
I'll be back. All right, I'm gonna lower your bed and take you off of it, but you're finished. Okay.
Lower the bed rail and the head of the bed. Put on gloves.
Touch your knees for me.
Ask Mrs. Cano to raise her buttocks while you hold the bedpan securely.
Okay, you can put your knees back down for me. Okay, now I need you to roll
Check
on your
her
side
anal
for
area
me,
to be certain
just
it is
make sure
clean.
everything's okay.
If a person cannot clean herself effectively,
Okay,
use fresh tissues for each wipe and clean from the perineal area back to the anus.
You're welcome. Okay.
Empty and rinse the bedpan. Then clean it with a disinfectant. Remove soiled gloves, taking care not to contaminate your uniform. Wash your hands and put on clean gloves. Then return the bedpan and clean cover to the bedside stand. Stools are normally brown in color and are soft, formed, moist, and shaped like the rectum. They have a characteristic odor from bacterial action in the intestines. Black or tarry stools may indicate bleeding in the stomach and small intestine. Bright red blood in stools could mean bleeding in the lower colon and rectum. Help Mrs. Cano wash her hands.
There you go.
Then provide for her comfort and place the call light within her reach. Lower the bed, discard any soiled linens, and wash your hands. Document your observations as well as any problems described to you, such as painful bowel movements, gas, cramping, or constipation.
All right.
Fracture pans are used when patients have limited movement or require casts or traction. Because Mr. Kowalski has significant pain on his left side, you are going to position him on the bedpan by turning him onto his right side. Put on gloves and lower the bed rail near you. Raise the head of his bed slightly.
I'm going to have you turn to your right side, and April's going to assist you over there.
Turn him onto his right side. Place the bedpan firmly against Mr. Kowalski's buttocks. Then hold the bedpan securely as you turn him onto his back. Cover Mr. Kowalski with the top linens and make sure he is correctly positioned on the bedpan. Raise the bed rail and place toilet tissue and the signal light within Mr. Kowalski's reach.
And we'll come in and take it away, okay?
Raise the head of the bed 30 degrees, if allowed or tolerated, to position him comfortably on the bedpan. Then, remove your gloves and wash your hands. Return when he signals for you.